It's really amazing to see the change in the lives of the patients.
We have that can-do attitude, and we try to do it the very best we can.
To see all of you here, I think it just inspires the newer patients to actually think about what lies ahead.
I had one foot in the grave. I was 410 pounds, and my wife kept saying, please, we've got 2 girls that are getting married, you've got to walk them down the aisle, and she just prayed that I'd make it through both weddings.
And my doctor was like, basically, you need to do something or 10 years you won't be here anymore.
Well, I was a young mother and I wanted to keep up with my kids, and I was having a very hard time doing that.
Just sick of being heavy. I've been heavy all my life and wanted to make a change.
For me, it was losing, gaining, losing, gaining. It just wasn't working, and I wanted something permanent.
The info session is really the gateway to the program. It's an opportunity to meet the team, the surgeons, the dietitians, myself, our patient care coordinator, and be introduced to the 3 options that we offer here for weight loss surgery.
I did the research, I had a good recommendation, and I met the group, met Dr. G, and I knew that this was the place that was going to be able to help me.
They go above and beyond, and you can call them 20 times a day with questions, and they're by your side every step of the way.
I took 2 weeks off, and I probably could have been back to work in a week and a half.
Honestly, they sent me home with a bottle of meds. I took it once and that was it. I didn't think it was a big deal at all. Very easy, very recovered, no hunger.
My wife says, are you shopping too much? But when you go from a size 58 down to a size 38.
I watch all my friends go on the water and in the sand, and I couldn't. Last year, I got to walk in that water.
It just makes life easier for me, just to be able to wake up and bend over and tie my shoes and, not be out of breath.
I'm able to coach my son's baseball team and just keep up with various activities, going out with my friends.
It's completely changed everything. My whole relationship with food is different. I don't look at it as, I'm going to eat now, this is just for pleasure. It's more for fueling my body and trying to keep myself healthy. You finally started worrying about my health.
And I love to be outside, I love to hike, now I exercise every day. I feel like I can do anything.
I now know portion control. I know the foods through the education, what is good for me, what I should be eating, and what I should be doing in my life.
I actually just got engaged afterward, and I never thought in a million years I would be able to see myself getting married.
Do your research. There's many kinds of surgeries out there. There's the sleeve, there's the bypass, there's the lap band. Go to an info session. They're very, very easy to go to. There's no pressure. You get to meet the staff, you get to meet the surgeons, all the support folks.
It's a great tool, but if you don't follow regimen, you'll put the weight back on. So you really got to know and want it and want to be able to make that life change.
It's a commitment, so be ready and be sure that you're committed to it, because it's just a tool. It doesn't do it for you.
I've learned that I'm stronger than I thought I was, because it takes a lot of discipline.
It changes everything for you. It gets you out there, it gets you moving, feel great.
Oh, everybody's just in awe, especially people who haven't seen me in a while. They don't even recognize me, they recognize me by my voice.
It's the best thing I ever did for myself, to be healthy.
It has changed my life, it's prolonged my life, it's made my life better.
I get up in the morning very happy to go to work. I get up in the morning happy to be alive. It was the best thing I've ever done.
I spent most of my life sitting back, watching my life and life go by. Now I'm living life.